Everyone. Very good evening to all of you. I hope you're having a good weekend. Today's episode number 6 is on labor and delivery preparation. Unfortunately, your host for today, Dr. Damodar Rao, could not be part of this talk, so I am filling his shoes today. My name is Deepika Rao. I am the admin head at RaoHospital. And last week we covered pregnancy myths, and it was a very interactive session, and we got great feedback from all of you. Thank you so much for that. Moving on to our today's topic on labor and delivery preparation. It's a very important topic for all you mothers to be. And the last few months can be a bit overwhelming for pregnant women. And I think knowledge and prep work about your delivery and regarding your labor gives you a feeling of some control over changes happening to your body. And this can be incredibly reassuring. And also it will help you make informed decisions about your labor and delivery, which also I think it helps you it gives you a feeling of positive and wonderful experience of your childbirth. So today's speaker is Dr. Suganya. She is our consultant obstetrics, gynecology and fertility at RaoHospital. Ma'am, over to you today.
Thank you, ma'am. So good evening, everyone. I'll be talking to you about how you can prepare yourselves for labor. You should know that pregnancy, preparation of labor starts right from the first week that you're pregnant, or right from the time when you know you have your missed period, and not exactly at the 40th week. See, at the end of third trimester, your body begins to show some signs that it's ready to ready for the arrival of your new. Although every birth is unique and hard to predict, preparing for it will still help you in relieving the anxiety during the process of labor itself. So I'm going to give you some pointers on that. So yeah, when do you actually know whether you're in labor or not? Usually people, like the pregnant women, are given an expected date of delivery during the start of the pregnancy itself, depending upon the last menstrual period or an age calculated according to ultrasound. But you should know that only 4 to 5% of women actually deliver on the same date. So a majority can deliver much before or even after the EDD. So when a patient goes into labor, you start experiencing hardening of your abdomen, rather called the contractions. The contractions initially may seem a little irregular, and the frequency might be spaced apart. The intensity might not be so intense, but as labor progresses, the frequency becomes much closer, the intensity increases, and you get more regular contractions. When you have experienced something like that, it means that you're in labor. Or you can experience something called as leaking per vagina, which is a watery discharge through your vaginum, or sometimes even bleeding per vagina. And there are different kinds of labors and deliveries. One is a normal labor. Normal labor can again be spontaneous, or if the doctor feels that you've crossed 40 weeks and you've still not gotten into labor, the doctor may do some vaginal application or through IV, or may even keep some vaginal tablets or give you oral tablets as well. And normal delivery, if it becomes a little difficult, the doctor might offer you an instrumental delivery, that is using something called as the vacuum or the forceps during the delivery, just for the delivery of the baby. And the other mode of delivery is cesarean section, as you all know. And cesarean section can be a planned section or a scheduled section, that is an elective section. If your baby is too big, your pelvis is too small, or if the baby has some congenital anomaly, or you're at a high risk with some medical condition, or if you've had more than 2 previous cesarean sections, the doctor will straight away ask you to go ahead with the planned cesarean section. And again, emergency cesarean section, if the doctor feels that there is a problem either with the baby or the doctor does not expect good progress of labor, might want you to go in for an emergency cesarean section while you're in labor. Now, coming to the stages of labor, it helps to know what the different stages of labor are that you're going to go through it. There are mainly 4 different stages of labor. You should know that the muscles of the uterus start contracting, and as there is a lot of pressure that is caused by the contractions, the baby is propelled downwards. So the cervix is the lowermost structure of your uterus, which is a tubular structure. So as the baby is propelled downwards, the cervix slowly is taken up or becomes thin and then starts dilating. It is when it becomes 10 centimeters in dilatation is when your baby will deliver. So stage 1 can again be divided into early and active stages of labor. See, early labor is when, as I said, you have irregular contractions and your contractions is spaced far apart. This is when your cervix just sitting up and is dilated up to 3 centimeters. So you may have contractions once in every 20 minutes or sometimes 25 minutes also. And it may not be as painful. And the active stage of labor is when you get much more intense contractions spaced every 5 minutes, every 10 minutes, lasting for a longer time, maybe 45 seconds. And this is when your cervix dilates from 3 centimeters to 10 centimeters. You should bear in mind that all these time frames can be a little earlier in case of people who have already given birth to a baby vaginally. Now coming to stage 2 of labor, this is when the actual birth takes place. So now your cervix is 10 centimeters dilated. So the doctor will perform something called as the episiotomy, if required, on your perineum. It's a small cut to widen up the space for easy delivery of your child. So once the doctor gives you an episiotomy, you may experience these contractions, and with a heavy contraction, you'll be able to deliver a baby. You should know that this usually takes about an hour after complete cervical dilatation, but again can be shorter in case of a person who's already delivered a child. So your baby is born, the cord is now cut and clamped and cut. So now you're coming into the third stage of labor, which is the delivery of the placenta. So this is much more painless when compared to your previous stages. With a few contractions, your placenta also completely comes out. And this is when your cord blood banking is done, as in the blood required for banking is taken at this point of time. So next is the fourth stage of labor. The doctor will perform suturing of your episiotomy if she's given you one. And this is the golden hour, or a few hours after delivery. You may still have these after pains. You may still have a little bit of achiness. And this is a time when the doctor will want to observe you carefully for any excessive blood loss, and will have a look at your pulse rate, BP, and other vitals. And then after this fourth stage is when you will probably be shifted back to your room. So it is worthwhile to know what mode of painkillers that you would like while you're experiencing these stages of labor. So epidural is a painless delivery, but you'll have to take a call on whether you need an epidural or not much prior to getting into active labor, or it can even be taken in active labor, but not really very late. You should know that epidural does not give you 100% pain relief, but it makes you way comfortable through the labor process. And it's a small thin plastic cannula that is inserted into the bag, into which the drugs are injected every time you have an increase in pain. So this is one form of pain management. If you're not willing for epidural, you can get with intravenous or intramuscular injections of painkillers during labor. And or during cesarean section, the doctor might offer you a general or preferably a regional or a local anesthetic that is again given into your bag, and that numbs the lower part of your body. If you're a person who wants to go for a natural, completely drug-free labor, you'll have to keep your doctor informed, but you can always change your mind during the progress of labor. Now, coming to antenatal classes, it is definitely important for you to go to to take some antenatal classes, because it helps you, it teaches you a lot about these stages of labor, your mental health during the process, and how you can cope up with these different stages of labor, the different relaxation techniques that can be used during these stages of labor. Not only that, post-delivery breastfeeding, how to swaddle your infant up, and how to bond with your infant, simple massaging techniques, all these are usually offered in an antenatal class. So if you're taking an online class, it's definitely advisable for your partner also to join in for a couple of sessions. Now coming to exercise, breathing, and relaxation techniques. Towards the end of pregnancy, it's always better to keep yourself moving along. So you can aim for at least 20 minutes of regular walking, if not for 40. And any sort of exercises like that can help strengthen your pelvic muscles like Kegels, or doing certain other exercises like the butterfly pose, the cat pose. All this is going to help during during labor. So you can also add in a few squats, everything to your routine. Don't entirely depend upon your exercises. You can also go about doing something around your house or your office. So keeping yourself moving about will actually help during the labor process as such. And again, antenatal classes will help you with breathing exercises during the labor process, how to start with a slow breathing and go ahead with a intense breathing, and how to push your baby out. So coming to the hospital checklist. So now you know that you're going to get into labor anytime. So it can happen just in the middle of the night. So it's always better to be pre-registered in the hospital that you're planning to have your delivery, because it's important for the doctor to have your history before he or she sees you, because it may not be possible to extract the entire history in the last minute when you're actually in labor. And also the drugs that you've been on, because certain blood thinners and all have to be stopped a few days before your delivery is being planned. So please go to your doctor for your regular antenatal visits and frequent visits during the last few weeks of pregnancy, so that the doctor can titrate your medication. The doctor can tell you when to come in for a membrane sweep and stretch and all that. So you can create a hospital checklist with the things that you would like to take when you're in labor. You can have your nursing gowns ready. You can have some loose fitting clothes, some toiletries for you and the baby, nursing pads, nursing bras, breastfeeding pillows, and even some relaxation tools like stress balls and music of your choice, some journals. So anything that can basically ease you through labors, having some wet wipes and some footwear, whatever you're comfortable with. So you can have it all packed up and ready, so that anytime you get into labor, you'll just have to take it and leave. And also keep a list of emergency contacts ready as well, because if you get into labor, it's always better to have a transportation immediately ready on call. So I often get this question as to when the working women should stop working before their EDD, that is the expected date of delivery. Well, there are no hard and fast rules here. Some people prefer working even up to the date of, until the date they get into labor. But some people would like to take a week or even a couple of weeks off so that they can prepare themselves mentally as well as physically. Well, this is entirely dependent upon how you feel about this whole situation. There are no hard and fast rules, but if your doctor feels that you have to take some rest, then it's advisable to go as per your doctor's opinion. Regarding intercourse, will intercourse kickstart labor? Intercourse doesn't really kickstart labor as such, but if your labor is on the way, it definitely will help in moving things along. Now, coming to the mental health. Well, you're going through this pregnancy, preparing your birth with a completely different paradigm and a completely different mindset. So somebody else's perception of pregnancy and birth can profoundly shape the way they have experienced birth. So it's already, you're not going through the same thing as maybe your mom went through, or your sister has gone through, or your friends have gone through, because labor is unique and different for everyone. See, preparing yourself mentally gives you a chance to work with your fears and your anxiety as well. It always helps to involve a support crew during labor, like you would like your husband or you would like your friend. During labor, you can just give them a call and you can plan ahead in time as to what kind of mental help you would like to have from them. If you still feel you're not getting enough support, please reach out to your doctor. She'll always put you through someone who can help you in the process. Now, coming to some things that can help during labor. So some patients will want to, you'll automatically feel quite exhausted, fatigued, and hungry during the course of labor. You may not be allowed to have a complete meal during labor, but you'll be allowed to have sips of oral fluids, some tea, and some juices without pulp, clear soup, and sometimes even a piece of toast if the doctor feels the delivery is going to be an uncomplicated one. And you'll also be asked to suck on some ice chips, because again, all these breathing exercises make you feel dehydrated. But if the doctor feels that you can head in for a emergency cesarean, as in a cesarean section, or the doctor feels that the progress is not as good as he or she expected, she might ask you to not eat or drink anything by mouth. And regarding movement in labor, you can walk around when you're in labor, and you can do all the squat exercises when you're in labor. And because of all this fluid drinking, your bladder is going to get filled up and it's going to get into the way of your uterus. So moving around and using the restroom will actually help in opening up the uterus a little bit more. So these are the things that you can do during labor. You can listen to some music if that's going to help you. You can have your loved one nearby if the hospital rules permit. And regarding cord blood banking, this is something I spoke about in the previous talk itself. Please make a decision whether you would like to have cord blood banking done for your child, because certain preparations have to be made, and this definitely comes at a price as the blood is being stored for a long time. So it's basically the components of the blood from the placenta that is used and used for purposes, used for curing diseases or used for certain genetic conditions in the future. So this is all that I have to tell about generally labor and birthing in detail. See, another thing is you should know that this birth is actually an incredible process on many levels. It can be incredibly intense, incredibly powerful, and also incredibly quite vulnerable. So it can be quite overwhelming also. As much as you're mentally and physically prepared for this whole process, you can still not really be sure about what to expect, and that is all right. So you're going to need the strength and power to mother your little one, always thinking that you're doing this for you, and your baby actually helps during the progress of labor and delivery. So good luck for a good birth. Thank you.
Thank you, ma'am. That was very informative as always. I would also like to mention, like ma'am said, that it's important that I think mothers join a good antenatal class. And we are also offering a very good course of a very detailed course at our hospital. We have tied up with someone from Sankalpa. Her name is Mrs. Sheila. And she's going to bring about a really, really positive attitude and a wonderful change in your entire birthing experience. So we strongly do recommend that it will help your labor and delivery experience. So do join a good antenatal class during your last trimester, or maybe earlier if you have the time. So ma'am, we have a few questions that have come in. Let's start off with it. Hi ma'am, is delayed cord clamping good for the baby? I've seen many parents talking about this on my mom's group.
Cord clamping, okay, delayed cord clamping is the prolongation of the time of your cord clamping. So the baby is born, so we take some time so that some blood from the placenta and the mother reaches the baby, and then clamping is done. So it usually lasts for about 25 seconds to about 5 minutes. See, this is helpful in increasing the blood volume of the baby and also helps in preventing certain conditions like anemia. So it's definitely advisable to do a delayed cord clamping, and we do that in our hospital. So if you're a little concerned about that, you can definitely tell your doctor that this is what you would like to have during your delivery.
Okay, ma'am. Next question is, hi ma'am, I have a lot of anxiety about breastfeeding.
Well, anxiety about breastfeeding and during breastfeeding is very common, so you're not alone. See, a lot of hormones also play a huge role in causing this anxiety. You're really not sure if you're feeding the baby enough. You're not sure if the baby is latching enough. You're not sure if you're supposed to wake the baby up and feed. There are like so many questions around this, and you do have a lot of your relatives coming and giving their different opinions about how to breastfeed your baby. So the anxiety level naturally increases whether you're doing it right or not. You can take antenatal classes that can help you with breastfeeding techniques. And in our hospital, we have an expert, a qualified lactation consultant, Dr. Parvati, who can help you regarding all your questions related to breastfeeding as well as anxiety. I highly recommend you to come and visit us.
Yes. Thank you, ma'am. Next question is, hi, doctor. Someone mentioned kangaroo care to me post-delivery. What exactly is it? So even I've been coming across a lot of this called kangaroo care. I think it's skin to skin, ma'am. Skin to skin care. Is that what it is?
Yes, 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 yes. It is. It is. It is. Just the like the name suggests. It is when the child is placed over the mother's body. So the skin to skin can contact between the mother and the baby is usually done in case of low birth weight infants, because there is a better physiological bonding and there is a better heat transfer to the baby. It is been seen that continuous kangaroo care has actually resulted in increasing the birth weight of the, increasing the weight of the infants. And it, even if it cannot be done continuously, the hospital sometimes will recommend you to do even at even at intervals. It definitely has a huge emotional aspect to the mother and the child. Definitely helps in better bonding, and it's also quite economical in a few situations.
So we are actually offering skin to skin also for a few years now in the hospital. But I think like parents don't understand that sometimes the procedure is not over or there is still a lot happening in the OP. So immediately giving skin to skin is a little difficult when there are nurses around you, when the doctor is around you. So definitely we will give skin to skin, but I think it's after everything we're ensured that the mother is fine and then we move her to the ICU or recovery room.
Right.
Right. So the next question is, how long do I have to wait to get back to my pre-pregnancy workout after C-section?
All right. See, if after discharge from your hospital, if you're quite comfortable with the pain and you're able to do your routine activities, you can start off by climbing a flight of stairs up and down. Start off slowly, but and you can do very simple exercises like simple stretches, simple yoga, maybe 10 minutes of swimming. All those very light intensity exercises are okay after the cesarean section, but again, if you're planning to go for running or you're planning to do something a little more intense like jogging fast or weight training, you will have to wait for about 6 to 8 weeks after your cesarean section to help in complete recovery and to help in the wound getting completely healed. You should definitely contact your doctor before you start off anything very intense post your cesarean section.
Okay, ma'am. I think there are a lot of mothers that put a lot of pressure on themselves to look good now and snap back to their pre-pregnancy bodies now. So I think everyone should take it easy. You've just delivered a living human new life into the world. So just enjoy that phase. And of course, weight loss and everything will come. But do give more attention to your baby and yourself and enjoy that bonding phase with your newborn before you get into your fitness mode. Next question, ma'am, is do I need to have a birth plan? Currently, I've just completed 30 weeks.
A birth plan is just an outline of how you want your birth to go about. So it can have a lot of components in it, like who can stay with you during labor, what you would like next to you during labor, and also what kind of anesthetic you would like. So it's in the Western countries, they always give the antenatal mothers a chart towards the end of the third trimester. It will be a compulsory birth plan, but we do not follow the same in India. But yes, definitely, if you're well informed about the choices that you can make during the delivery, you can definitely write a birth plan and hand it over to your doctor. So it can also contain your decision regarding cord clamping and how fast you would like to breastfeed the baby, and also regarding delayed cord clamping as well. So all this is what we see in a birth plan, and it may not always go exactly as you have planned, but the doctor will surely try to uh, have most of the things done during the process of labor.
Yeah, and I think also because of COVID right now, most hospitals have a lot of rules and regulations in place, especially with regards to IP. They're insisting on the patient doing COVID tests before the patient gets admitted, and the number of attenders is restricted for the patient. and no visitors at all at this time, just to minimize risk for of infection or any COVID chance to the mother and the baby. So even at our hospital, we are not allowing any visitors at this time. And we also advise you that once you go back home, try and keep a minimum number of people interacting with your child in order not to increase the chances of COVID or any other infection for the baby and the mother right now. So next question, ma'am, is if I'm experiencing contractions, do I need to come to hospital immediately, or should I call hospital and then come?
If your contractions are mild to moderate, that is, you have contractions every 5 to 20 minutes, not very intense, irregular contractions, you can still wait, but then just definitely have all the things packed and ready. But if your contractions increases and is more intense and you've leaked, you're not sure what's happening, then it's better to come to the hospital right away. So if you're really not sure about whether you're in active labor or you're in early labor, should you wait, should you not wait, or you feel the baby movements are not okay, please come to the hospital immediately. Don't wait to contact your doctor, because if you're not sure, it's better to come so that we can evaluate you and see what has to be done further from there on.
I think that's all the number of questions, ma'am, for today. It was a very informative session from you, as always, Suganya ma'am. I think it's very important for everyone to go through labor and delivery preparation properly so that they have a very informed decision, like I mentioned earlier. It just helps you puts you in a frame of mind of preparedness as well. So, and our doctors are always available. And like I mentioned, we have antenatal classes available now. So please do sign up for it. And our doctors are there. We have an excellent lactation consultant as well at the hospital. So any doubts, anything, we're always there. And we'll catch you not next week, the week after that, with another interesting session, a guest speaker. So please do log in then. Thank you so much, ma'am.
Thank you. Thank you.
Thank you.